in mind. There are times when we feel sad, stressed, or frightened. Most of the time, these feelings pass, but they may indicate the onset of a painful mental disease that could happen to any one of us. A mental disorder may be defined as a health condition that changes how a person thinks, feels, or behaves, or all three, and makes it hard for them to live their life. Schizophrenia, depression, anxiety, alcohol dependence, and other mental health conditions make up 13% of the global burden of disease, more than both heart disease and cancer. By 2020, an estimated 1.5 million people will die each year by suicide. In Europe, brain disorders cost almost 800 billion euros a year. But despite all the money that is spent, studies estimate that in high-income countries, only half of the patients living with these illnesses receive mental health care. Research has shown that more than half of adult mental illnesses have their origins early in life. By the end of their teens, about 3 in 10 young people will meet criteria for a mental health condition severe enough to disrupt their daily lives, with more than 1 in 10 having significant impairment. Children are most commonly affected by anxiety disorders, followed by behavior disorders such as attention deficit hyperactivity disorder, ADHD. Mental health problems can have drastic effects on a child's ability to function emotionally, socially, and academically. To be diagnosed with a mental disorder, a person must be evaluated by a qualified professional who has expertise in mental health. In many cases, a mental health professional who is not a psychiatrist will refer the patient to a psychiatrist and to a psychologist. A psychiatrist is a medical doctor who has received additional training in mental health. Psychiatrists assess the patient's mental and physical health and can prescribe medication. Psychologists are professionals who have a university degree in psychology and postgraduate training and expertise in many different areas such as education and mental health. They are not usually medically qualified. Psychologists are trained to help diagnose a condition or tell more about the way a person thinks, feels, and behaves. They use a wide range of treatments to help people. Most commonly, therapy referred to as psychotherapy or talk therapy. It's difficult to diagnose and treat young people with mental health problems due to the many changes that occur during childhood and adolescence. The symptoms they experience and their responses to treatment can differ from adults. Very few trials of new drug treatments involve young people, as there are ethical concerns surrounding consent and the impacts these studies may have on their health. That's why adult treatments are often given to young people without previous testing in these age groups. Most treatments for mental disorders combine psychological and drug therapies with family, school, or community-based interventions. Psychologists use many different psychotherapeutic approaches to address mental health problems. It is usually difficult to identify the cause of a mental health condition because biological, psychological, environmental, and social risk factors are often involved. But the relationship between these risk factors and illness isn't clear. Scientists are currently developing new techniques and imaging tools for studying the brain to investigate how all these different risk factors work together. Mental health professionals and researchers around the world are calling for increased investment in mental health research to improve our understanding of mental disorders and our ability to prevent and treat them. People living with mental health problems, their families and friends, and the professionals who support them know that stigma still surrounds mental health and there's confusion about what it means. These issues continue to prevent people from seeking help.